While this area and region and nation have been concentrating on the issue of fighting COVID-19 through testing, social distancing, and vaccines, there has been another health fight that we may have all lost sight of, where we have had some success in the past, and that is driving down abuse of heroin and opioids and their related deaths. In recent months, possibly because of the isolation brought on by COVID-19, there has been an increase locally, regionally, and nationally in overdoses related to opioids and heroin, as well as an increase, hopefully not linked, to an increase in domestic violence cases. We'll talk about that particular issue of domestic violence next week with Cayuga Community Action Agency's Director of Family and Victim Services, Frank Barwinczak, where we'll talk about the local spike in domestic violence incidents. Tonight, though, we'll focus on the increase in overdoses. We've asked that the Healing Community Studies Project Director, Monika Salvage, who's been here in different capacities over the last couple of years, from the Healing Community Study to join us to talk about the overdoses and their increase, but also to talk about the Healing Project, their objectives, and also the factor of making Narcan available, and we'll talk a little bit about that. Welcome back. Nice to have you here.
Thanks, Guy. Good to be back.
Different capacity here, so let's talk. I want to get into the Healing Project, but let's talk about what we originally started with when I sent you the original email and had Kathleen Cuddy here a couple of weeks ago, and that is that we are seeing an increase in overdoses and in fatalities related to the abuse of opioids or heroin. Am I correct on that? So, and part of this is also not only those, but also something called Molly in there. And first of all, who doesn't know what Molly is, what is Molly?
Well, Molly is a synthetic stimulant that, if you remember bath salts a few years ago, it's something similar to that where the consistency constantly changes.
So it's tough to outlaw then.
It's tough to outlaw because also when people are being drug screened through urine analysis, it doesn't show up. So it's hard, for law enforcement to actually pin somebody down, saying that they've used or misused illicit substances because it doesn't show up in the drug screen. But people who have used it, exhibit like very almost psychotic side effects from that high, all the way to, feeling chased and feeling that, somebody's after them. So it's a very different type of effect that people have when they use it.
And we're not going to get into a lot of numbers. We will in a second of some numbers, but of the spike in overdoses and where it comes from, opioids, heroin, or Molly, do you have an idea of what the range is in that? Because there has been a spike.
Right. So overall, when we talk about opioids, we talk about prescription opioids, which could be prescription painkillers, for instance. That has gone way down over the years. That was a big issue 10, 15 years ago.
Because there's started restrictions on there.
Yes.
And the supply is also dried up.
Yes, and a bigger focus on safer prescribing also.
Okay.
And then opioids are also, it's the heroin. Fentanyl is a big problem now, which is also an opioid, but it's a synthetic opioid, and a lot of heroin, for instance, could be spiked or could be laced with fentanyl, and it's very much more potent than heroin, so it's also very much more fatal. And then Molly is that, that weird substance that nobody, people would, relate it to ecstasy, but it's really not that. It may not be as fatal as fentanyl, for instance, but it's definitely, the side effects are much more severe. But so for heroin, we knew that we had in 2019, we had about 25% of all the overdoses in the county were related to that. Since COVID, it has risen to like about 30% of all the overdoses. And now in January, February, we've seen that around 28%. So it's definitely has increased. So the heroin is very much a problem still. It's not gone away.
So again, I don't want to get into a whole lot of numbers, and then we'll talk about fatalities. So you gave me an interesting chart. You sent me a lot of great data here. And so in 2019, so 2 years ago, the average overdose cases per month, and this is countywide, I'm assuming, was about 15. Since COVID, so literally a year ago this week, that jumped from 15 per month to 18. In January and February alone, that number has jumped from 18 to 26. Of those overdoses, how much, do you have a percentage of what is roughly fatalities?
Well, we have about a third of them are opioid related, so just shy of a third. So we know that. And then the fatalities, I mean, we had 21 in 2020, which was more than double to the 9 that we had the year before. So far, January, February, we had already 5 people that we've lost. So we definitely see the trajectory going in a not a good direction.
So you went from double to, you're on track to do double again, or more. So how this came about was we've had Chief Butler on, and then I also occasionally read the obituary page, and there are a lot of young people who we have seen they don't have a cause of death, whether it's COVID or something related. So that had translated into some other conversations, and that's why we asked you here to talk about that, and also because of what your project is dealing with. Just some basic sense of where the problem is and where the issue is. Geography-wise, about 73% of these cases are in the city of Auburn or the donut towns. But that does not mean that they don't hit. I mean, I looked at some of the great charts you did with the map. They're happening almost everywhere in Cayuga County.
And that's a really important message because it's not a city problem. It's not only an Auburn problem. Obviously, we have the concentration is here just by population, but it's happening all the way up to the north and all the way down to the south in the county. So it is a countywide problem, definitely.
And if you look at just the last 2 months, I thought you sent me a chart where it just showed the city of Auburn, and the concentric area would be in the downtown area and around there, where you would most likely consider higher levels of poverty. One of the other numbers that stood out to me was data by race. So if I'm reading this correctly, almost 86% of the deaths here, or overdoses, are Caucasian. Any reason for that? Is that kind of mirrors a little bit of the population somewhat? Not a lot, but it comes closer to the population of Cayuga County.
Well, it's hard with the racial data because it's not always reported consistently, and even with the fatalities, we don't always know the race of the person. But anecdotally and from the data we've seen, it does show that that we have a predominantly white population that is suffering from that. And
so the main sources of data are obviously a coroner and a hospital, but the sheriff, the police, and the troopers. Yes, so whenever there is a reported overdose, meaning that somebody either called 911 or went to the hospital for it, there is a record of it. And law enforcement are automatically called to the scene if somebody calls 911 for an overdose, and so they report that data into a statewide system. It's called ODMAP, and that's where we get our data from in terms of the overdoses, the Narcan administration, who responded, and that's the reported data. I mean, we're aware that there's obviously a dark numbers that we don't know that are not reported. Not everybody reports overdoses when they happen. So some might contend, and I think you make this point in the paperwork you've given us, is that a lot has changed since March 13th of 2000 overall when it comes to dealing with these issues, and that may have an adverse impact on the spike. And that would be, for example, a lot of support groups have stopped. Is that still the case? Not necessarily. They stopped for a long time, and but most of them have taken up some capacity of in-person meetings again, like Nick's Ride, for instance. They're meeting again in person at the clubhouse with restrictions and with safety protocols, and some of them went to online. I don't know that necessarily always works for people, and so
So it has gotten better over that year. You know, we're definitely seeing more support groups, you know, meeting in person again. But there's still the economic issue. People lost their jobs. People, you know, are in fear of losing their homes. They're being isolated. If you're using drugs, you use them alone, which is also more dangerous because chances that somebody's there to call 911 are lower. So a lot, you know, schools are closed or in a hybrid model. So a lot of those things that came together, we've seen, you know, statewide data that shows it's not just drug use, it's alcohol consumption is up, cannabis sales are up, and then the overdoses overall are up, mental health calls are up. So it's a whole slew of issues that sort of converged on people with mental health and substance use.
Cascades on to everything.
Yes.
So this was not from the data I think that you provided me, but from a different article that I read locally. Is there a connection between suicides and drug use at this stage?
From what we've seen from the coroner's reports, I believe suicides have gone up.
Yeah, there is a spike. That's
last year, but they are not necessarily related to, you know, using drugs to commit suicide.
So broadening this up, you're the project director for the Healing Project. For anybody who doesn't know, and I know we've got the web connection up on the screen. What is the Healing Project?
So Healing Community Study is a national study that is funded by the National Institute of Health and through the National Institute of Drug Abuse. And what they're trying to do in different states, we have 4 states that are involved in that, and in each state we have several communities. Overall, I believe it's 67 communities that participate in that project. And with the general idea of figuring out ways on the local level how to best reduce opioid overdose deaths. So while we're all working under the same study parameters, the local group, and we have a local steering committee that is working with us, the local group has very much leeway in terms of interventions that we're implementing here. And we can select from, they call it evidence-based practices, which means interventions that have been researched, that have been proven to work in other communities and are based on science. But we can basically choose what we feel works best in our community. So while all the communities work in a similar fashion, everybody can sort of decide what they want to do, what's the best fit for their community partners and the community members.
So the states that are doing this are New York, Massachusetts, Kentucky, and Ohio. So have relatively large metro areas and large rural areas. So in New York, there's 16 communities.
Yep.
Are they largely counties like Cayuga, or are they across the spectrum when it comes to size and income?
Very much. The study really put a focus on having metropolitan areas, big counties, but also then also rural counties, and with, you know, I think the smallest one has like 27,000 population, all the way to, you know, like very big counties. So they definitely sought a balance in the types of counties, and how we were selected were, you know, unfortunately, but for...
Our numbers are up.
Yeah, and that was based on, you know, a few years back. But so if you had a higher than average rate of overdoses in the county, you know, you were selected to participate in that study.
What's the closest neighboring county that would be involved in the 16 for New York?
Well, right now, the way they do it, because it is a study, although it's very practical in terms of we can do implementation, we're not just looking at things, how they try to determine that this approach, this community-based approach works, is they have 2 waves of counties. So they split them in 8 and 8. And so the first wave, like us, we started last year, and the second wave is sort of the control group that starts later, and they want to show that there's a difference in outcomes. So like the closest one for us is Cortland County, but they're in wave 2, for instance. So they haven't started
And is
yet.
this all funded by NIH, or is there a local share?
Nope, that's all funded through that grant.
So you said 3 years. You're just are you just finishing your first year on this?
Well, actually, we're finishing our second year because most of the first year was prep work through our research partner, which is Columbia University in New York City. And so they started already in 2019 with all the prep works for all the different counties, and then we actually started in 2020. So this is already the end of our second year.
And how large a staff is working on this? You're the project director.
Mm-hmm.
How many people work with you locally?
So we have a team of 4. We have a data analyst who collects and makes all those visualizations of the data, which is really helpful because we've never had that before. We only had very fragmented data, but not countywide and not in real time either. And then we have a technical assistance coordinator who basically works with our local partners that we are working with and gives them the assistance that he needs and then that they need. And then we also have a community engagement facilitator, and he works also with our partners, but on certain initiatives.
So this is run out of the Department of Health, Cayuga County Department of Health.
Mental health.
Mental health. And the goal that you have on the chart, and again, I'll get into the twist of COVID, is the overall goal of this project, locally and nationally, is reduce overdoses by 40%. So how big a wrench is COVID in that goal?
Well, I think we've seen it in all sorts of areas, and it certainly hasn't been spared in this area that the last year has just been unprecedented for anybody. And what NIDA, or National Institute of Health, did to accommodate for that, because they saw that a lot of the initiatives in some counties didn't come to fruition because people were needed otherwise and occupied other places, that they actually extended the implementation period by 6 months so we can accommodate, some of the time that we have lost. So the study has already accommodated for that, thankfully. But locally, I mean, I want to say we really hit the ground running after, because we had all the data already in April that showed the direction that we were going, and we really hit the ground running. Last April, because we needed to keep people alive.
And so you're not, if you looked at it this year, you would not have hit the 40%. Most likely it's the reverse because of, you could associate with COVID. So for this county, are you going till 2022, or will you go into 2023?
The middle of 2022.
And will that stop the project, or is there a possibility that Cayuga County, if it wants to pay for it, could continue that work beyond that?
So the idea is, and that's also part of that community framework, is that as we get towards the end of the grant time frame or the study time frame, that we develop local plans to make the work that we have been doing sustainable. So, and we're talking about this already, and obviously we're not there, it's a work in progress, but with whatever strategy we're doing that is now funded through the study, we're thinking about how can this be sustainable in the future.
So this might be part of the 2022 budget that Aileen McNabb Coleman will put before the legislature in the fall.
Well, some of the things may be integration into existing facilities also, because we're really trying to change or improve the system of care. And the idea is to really operationalize some of the things that now is a change, but hopefully a year and a half down the road, it will be operationalized, that some of the things that we're implementing stay.
You mentioned community partners. Could you tell us who they are?
Sure. So for our steering committee, who is really the body that makes funding decisions and makes decisions on strategies, we have it's about 20 plus people who regularly participate, and they are from a variety of sectors, basically anywhere where people with an opioid use disorder could interface. So it's obviously, treatment providers, people from the court system, law enforcement, education, people with lived experience. We put a very big focus on, having people involved, either family members or people who are in recovery themselves, to hear from them and involve them in the process. So again, it's a big yeah, a variety of people.
So how will you know that you've attained success? Because and again, and I don't mean to overbear the whole COVID issue, but we're not going to be through. I mean, vaccines are great, and people are moving through, and we would always urge people to get vaccines and get vaccinated. But some of this is not going to hit the wider population, you know, literally until May, July. You're most likely not looking at herd immunity if you talk to Dr. Fauci, or you listen to Dr. Fauci, until the fall and other. So how do you judge in that critical last year as you're trying to do it by the summer of 2022?
Where I landed, because I ask myself that all the time, and we ask ourselves that as, you know, as a group, as a team, where I land in terms of a general statement is that whatever we do every day that keeps somebody alive through our actions that day, that is success to us. What happens 2 weeks down the road or 2 months down the road with that person, there are a lot of variables that can happen.
Keep them alive.
But keep them alive, keep them connected, and get them access to services as best as we can. And I would also argue, you know, when you've looked at the data that, yes, we had a lot of fatalities last year, there is no doubt, but we also had a lot of people that were saved. And so the numbers could have looked.
So let's go to that, because there is a big. So you are part of your role is also public advocacy. You're public advocates here, and so one of those pieces gets a little complicated, and that's this whole issue of Narcan. And I think we've most likely had a half dozen to a dozen guests on over the last couple of years who've talked about Narcan. Remind us, first of all, for those who did not watch any of those shows, how dare you, what is Narcan?
So Narcan is, in essence, a nasal spray that can reverse the effects of an opioid overdose. So when administered, if somebody comes unconscious, passes out after an overdose, and it's sort of like a nasal spray, like when you have a congested nose, and you apply it, it will bring people, or potentially bring people back.
And we've seen an increase in the number of uses of Narcan locally.
Yes, and that was one of our first initiatives that we did.
Well, it's a big initiative.
Yes.
In 3 different fronts, and I'm going to break them down. But can anyone have, so when I first heard about Narcan, I want to think that it was Sheriff Gould on the show. So we obviously have a sheriff who's in his second or third year now. And other chiefs, Chief Butler, we talked about this, and Narcan was not generally available to the public, let's even say 7 years ago. It is now much more, correct?
Yeah.
Why?
I believe, so first of all, law enforcement has been carrying and administering it for probably 5 years now. And I think the powers that be meet, the state health department, and probably on the largest, it goes state by state, so it's not a federal thing, have realized that if people have Narcan at hand, if people is widely available, and our data shows that just as well, that it saves people's lives, and it gives somebody another chance to get help and get connected to services.
So the Healing Project has done 3 different types of outreach, I would call it. One has been this idea of online training. So you've, the last data I had was about 360 individuals have had access. So explain to me how online works.
Yes, so when COVID hit, we realized that there was no Narcan being distributed in the community in terms of there were no in-person trainings or anything. Everything was shut down. And so the first thing we knew we had to do was, we got to keep people alive long enough to get them to services. So we created on our county website, we created a page where people could watch an online video and get the training that way. And then they could request Narcan to be sent to their home via mail. And in that package, we also include other resources.
Were you surprised almost 350 individuals signed up for that?
Yes.
Did that stun you?
Since last May, yes, it did. Because when we started this, people were saying, nobody's going to put their name and address in there and basically admits that they want to have Narcan at hand.
So somebody can do that even right now. If they go to your website,
Yep.
they could do that.
And it's anonymous. I mean, it's that data, that information.
So it's confidential.
It's confidential. But what we saw is that through that method, we reached literally the whole county. Prior, the Narcan trainings were mostly in and around Auburn, and it was really hard to get to for other people. But now, like, all sorts of towns and villages are being served that way because it's confidential. You get it in the mail.
So that's an ongoing. Can somebody abuse Narcan?
No, you don't get a high from that. I mean, you can use it on children, on pets even, if they eat, pain medication or something.
Okay. So then you've also done pop-up events,
Mm-hmm.
and that number is closer to a little over 200.
Yeah.
So explain what a pop-up event is.
Well, so we did the online thing, and that really took off, and we got a lot of media coverage, and that certainly helped. But then we realized when we saw the data where our hotspots were in terms of, where we saw neighborhoods that were especially hard hit by overdoses, we were like, could we figure out a way during a pandemic to go out there and actually talk to people in person and safely train them and distribute Narcan where it's needed.
How many have you done?
We've done 4 in Auburn, and we did it strategically before the 4th of July weekend because we were concerned that during the holidays people were overdosing. Labor Day weekend, and then we also went down to Moravia because we've seen overdoses happening there.
And do you have other pop-ups planned?
Yes. So once the weather gets a little bit nicer, so our Drug-Free Community Coalition, along with the Sheriff's Department, they are planning some outreach in towns, so outside of Auburn.
And then you've also done trainings at the jail. Now, is that for the public or for public employees?
Inmates.
Oh, for inmates?
Inmates,
okay.
Yes.
And why do you want people trained?
Well, we want people trained because we want to convey this idea that it can really happen to anybody. And
so you had on that subject, you had an interesting number. You had 41% of those people who've been trained have seen somebody overdose.
Mm-hmm.
That seems awful high.
Yes. And so, and again, when we put this online, we put a lot of thought into what we ask people. We didn't want to be too intrusive that they didn't want to fill it out, but we also wanted to get data that could help us make future decisions for, strategies. And so one thing is, you can distribute Narcan on the street if you want to, but you never know if it really gets into the right hands. And when we saw that data, the 41%, it's like if somebody has seen an overdose before, chances are very high that that particular person will overdose again. And so for them to have Narcan in hand is very crucial.
So we got about 3 more minutes to finish up, because I want to get to stigma as well, because you've written about this. But there are some who will contend that by making Narcan accessible, you're condoning drug use. What's your response to that?
What's the alternative?
Well, some would just say, let them die. Let me be blunt.
And that's
I'm not saying I agree with that, but that's they're saying
and that's really,
action has consequences.
That's really the alternative. And until it hits somebody that's close to you, your kid, your neighbor, your somebody, you may change your mind. But the idea is having another day for that person to be able to change their lives, to get connected to somebody who can really connect with them.
And you've written that abstinence is not necessarily, well, that's the goal. It's not always easy to get to be the case.
What's that?
Abstinence. People just can't go cold.
Some can.
Okay.
It works for some, yeah.
So one of the criticisms of the healthcare system in the past has been the lack of access to facilities. Do we still have that problem?
Well, it's the easy access, because when people are ready to seek help, they need help then, not 3 weeks down the road or 2 weeks or whenever there's a bed available.
So it's a timing and accessibility issue, not just an accessibility issue. So you've also written, I want to finish up on this, you have written about the stigma of someone seeking treatment. There's a stigma associated with that. What would you like the Healing Project to help people overcome that stigma? And kind of explain what you were talking about.
That opioid use disorder is a disease, just like a chronic disease like heart disease or diabetes. And just the thought of refusing to help somebody who has that type of disease, or refusing medications, refusing treatment, and just say, well, just work out and eat better and you'll be fine. But then when it comes to opioid use disorder, there is that stigma around where you have to be off everything, and that's the only way for you to truly, that you can say that you have recovered. While recovery is really a lifelong process, just like other people are on heart
Or you've seen it
medications.
with alcoholism or
Yes.
other narcotics.
Yes.
So last question for you is, if someone is addicted, or they're a family member who wants to have their family member helped, or a friend, how's the best way about, and obviously we have your website up on here, but what's the best way for them to get somebody help or themselves help?
Yeah, so on our website there are addiction resources on there, so different types of providers. But what we really encourage is people getting connected to recovery peers, such as at Nick's Ride, because those are people who have lived experience, who have been there, and who are now trained to help those people on their path to recovery. So I would encourage people to call Nick's Ride at 315-246-6485, and they will then be able to help them, connect them to local services and to the types of services that they
And
really
you can
need.
go on the web and look up Nick's Ride. It's
Yeah.
relatively easy to access them.
nicksrideforfriends.org, I believe.
We did not cover medication for opioid use disorder, which is a really long thing to get into, but I'd love to have you come back when you're farther along in the study.
Yep.
I know you're in your second year, but maybe give us a preview of what is on the horizon, either in the fall or in the spring, to talk about this subject. We'd love to have you back on.
Yes,
Our
absolutely.
guest has been Monika Salvage. She is the Healing Communities Studies Project Director. We've had her on to talk about the use of opioids and heroin, as well as the large number of overdoses locally in the last several months. We want to thank you for doing this good work and look forward to having you back here in the future. We'll be back on Thursday, the 18th, with Port Barnes Superintendent of Schools, Neil O'Brien, who will be on to give us an idea of what his school district is doing when it comes to COVID-19. We'll also be talking about his service to the community. He is the longest serving superintendent of schools in Cayuga County, and he's retiring at the end of this school year. On Tuesday, we'll have City Manager Jeff Dygert in to give a city update, including a discussion about the new agreement for the double days. In fact, we hope to bring the new operators of the double days here in a couple of weeks. We'll talk about the city's response to COVID-19 and what he is doing to prepare for the 2021-2022 budget that is effective July 1st. And on Thursday the 25th, we will have Mr. Barwinczak in here to talk about the issue of the increase in domestic violence cases and reporting locally. We would like to remind you that we'll be doing our Zoom forum for the Auburn Large School District. That will be April 27th. I'll moderate that forum, and the questions will, of course, be asked by Jeremy Boyer, the executive editor of The Citizen. If you'd like to send us your ideas for questions or guests you'd like us to have, you can send us an email at cozguytho@aol.com or Inside Government, 141 Dunning Avenue, Auburn, New York, 13021. I'm Guy Cosentino for Cayuga Community College. We want to thank you for watching. Hope you have a good night. Have a great tomorrow, which happens to be St. Patrick's Day, and be safe. And we'll see you back here in the studio on Thursday.